old are you?
24.
24. Where are you from?
Sweden.
Sweden. Where in Sweden?
Stockholm.
Stockholm. I've never been to Sweden, but I hope so. How would you like your nose?
I want it slimmer, especially the tip, and remove this hump here.
Yeah. There seems to be a little bit depression on the skin.
Yes.
You have to feel it. How about the nostrils?
Maybe a slimmer as well.
Yeah. The profile is okay, but on front view, everything seems to be a little bit wide. A little bit wide in bony area. The most important thing to narrow the tip, and finally you have to adjust the size of the nostrils.
Yes.
It seems that the upper lip is a little bit long.
Exactly.
Yeah, we can reduce the length of the lip during the operation at the same time. At the same time, by removing a strip of skin from beneath the nostrils. We have two ways, one from the lip and one from the underneath the nose. But this one is very suitable for you because the scar will be somehow imperceptible. Nobody understands what has happened here. Yeah.
Yes.
The chin is okay, your cheeks are full, eyebrow, eyes, and convex forehead. Everything is suitable for a beautiful face. Thank you. Hi, this is Dr. Yahyavi from Iran, Tehran, facial plastic surgeon. Today, I want to talk about long lip. One of the minor concerns of many patients asking for a beautiful face is lengthening of the upper lip. There is no definite criteria for the long lip, but it seems that if the length of the upper lip is more than 16 millimeters, it is long. So, the cause of the long lip is two. One is congenital long lip and the other one that is related to the age. As the people get older, the length of the upper lip gets longer. So one of the responsibility of the aesthetic surgeon or facial plastic surgeon is to correct the long lip. We have two ways to shorten the long lip. One is by removing a strip of skin from immediately beneath the nose. We call it subnasal lip lift. And the other one, removing a strip of skin from immediately above the lip. We call it vermilion lip advancement. Both of these procedures can be done at the same time of rhinoplasty. As you see in this case, the length of the upper lip is too much. The patient is going to have rhinoplasty and at the same time shortening up of the upper lip, as we call it lip lift. This is the shape of the skin that we have to remove during the surgery. Depending on the amount of long lip, we remove up to 8 millimeters of the skin. This is the profile view. As I told you, it can be done at the same time of rhinoplasty and no problem happens. In next session, I will exactly explain on a Swedish patient that we are going to do rhinoplasty and lip lift at the same time in the operating room. See you soon. Bye. Now, the nose job or rhinoplasty has been done and we are ready to do the lip lift. I have marked the amount of skin that should be removed. Nearly 6 millimeters from the upper lip has been marked to be removed, and within a few minutes the length of the lip will be shortened. Now we are done. Everything has been done perfectly. The nose has been operated by reducing the size of the tip, putting a tiny piece of cartilage on the back of the nose to raise it. The nostrils has been reduced in size, and finally the lip lift has been done by removing 6 millimeters from the skin of the upper lip. Now we have a beautiful, nice incisor show from the upper teeth. The scar has been hidden in the crease, and within a few months it will be completely imperceptible. Thank you.
Hello. From the moment that I came to Iran, Dr. Yahyavi and his team has taken such a good care of me and made me feel completely safe and comfortable with everything since I came here alone. The surgery did go very well. I could go home after just a few hours since I did not have any pain or discomfort at all. And the next day I could go out and do whatever